The year is 2014. Your organization's been using the same application server for about 10 years. It's about 5 years longer than you should have, but it's time for an upgrade and you know it, so let's get this done. So you hire an IT company to come out and put a new server in for you. They put the server in, they migrate the data from the old to the new server, and everything went flawlessly. As a courtesy to your organization, they offer to dispose of the old server for you. You say, sure, why? It's one less thing to worry about. Let's make this happen. So the IT company takes the server and sits it on a rack in their office, where it sits for many years. Well, that server has become a ticking time bomb that's now outside of your control. The statute of limitations for HIPAA compliance really doesn't exist. If that server with the ePHI that's on it ever materializes, you're still liable for it. But servers aren't the only place where ePHI can reside. Also on workstations, which is a place that many companies deny that electronic protected health information could reside. Let's dive in and look at that. A myth that many customers believe is that because they have a server and their software resides on the server, that they have all their electronic protected health information on that server. The same is true for customers that have a hosted environment, like a third-party company that hosts their server off-site or serves up their application through the web, like through Internet Explorer or Chrome. That does not natively make you secure or HIPAA compliant. No matter what your sales rep has implied, it does not secure your data. And I'm going to explain why. Data has to get into and out of your system, typically using an intermediary. In other words, your local computer. When your receptionist scans a face sheet or any kind of medical information using their scanner, that usually gets stored on the local computer at the office. And then from there gets copied up to a server or imported into an application in some way. That means that you have electronic protected health information on that computer. People have been told this for, probably about 20 years now. Once data is on a computer, it is pretty much on there forever. So you need to assume that anytime you have a device that takes data in and out of the system, it's going to have electronic protected health information on it. So I've got a little example here. This computer right here was taken from a client site. It's about 8 years old, so it's been storing information for quite some time. So let's assume this was a receptionist computer. I'm going to turn it on its side, and I'm going to show you how data gets on here. So your receptionist is storing face sheets. She's storing all kinds of medical records on here, just scanning them in using a scanner that's attached to it. Usually you see the little Fujitsu scanners or the Ambir scanners, so it's scanning health cards, lots of patient information. So this is that data. It's getting scanned into there and stored on that computer temporarily. But we're also manipulating faxes. So the hospital will send faxes over. So here's some faxes, more faxes. At the same time, you're actually asking your receptionist to generate reports for you. So you wanted to know how many of your patients had the sniffles going back to 1842, and that's one big report. So here's that report, and you've got about maybe 6,000 records with patient names and diagnosis there. So we filled this now with ePHI, and you just replaced it with a new computer, and you had your old IT company take it off-site. Well, do you see the problem here? How did you track this computer leaving your organization? Did you have an asset tag on it? Do you know that it's been destroyed? Does your current IT company have an asset tag or any way to show you they've taken responsibility as they remove the device from your organization? It's definitely cause for concern if you don't. And what is the statute of limitations on this? Well, there is none. We've already established that. So this computer is floating around somewhere, usually going to a refurbisher or being donated somewhere, and anyone can find that data on the drive if it wasn't properly destroyed. Not fun. If you're watching this video and you're saying to yourself, I've never cared about HIPAA compliance. How screwed am I? I've got assets everywhere that I've never tracked. Well, really that's the wrong question. You shouldn't be asking any questions at all except for, how quickly can I become compliant? That way, if the Office of Civil Rights comes knocking on your door, you can show that you've got your house in order, even if it was not in order at some point in the past. Well, that's all I've got for today. If you have any questions or concerns or would like to learn more about HIPAA compliance and what ArcLight can do to help your organization, feel free to reach us at the number on your screen. Have a wonderful rest of your week.